We aim to look at the cardiorespiratory fitness levels in patients undergoing oral and maxillofacial cancer surgery to look at the potential benefits of prehabilitation. So we retrospectively looked at all patients undergoing oral and maxillofacial cancer surgery who were referred for preoperative CPETs between December 2019 and June 2021, and the data of the cohort are summarised in Table 1. Out of the 109 patients referred for CPET, 2 patients were unable to perform the test and 1 test was submaximal in nature. We explored objectively measured fitness values using CPET, as it has been shown to identify individuals who are at increased risk of postoperative morbidity. Based from previous work by Lalabekyan and colleagues in 2021, the cut-offs used for the anaerobic threshold was less than 10.1 mils per kilogram per minute, and for VO2 peak, it was less than 12.3 mils per kilogram per minute. Other variables such as BMI and hemoglobin, which have been associated with increased postoperative morbidity, were also recorded. As stated, we used thresholds from previous local data in the prediction of morbidity. In reviewing our patients, we found that 6 patients were underweight and 30 patients were obese. 26 males had a hemoglobin value of less than 130 grams per litre, and 11 females had a hemoglobin value of less than 120 grams per litre. More surprisingly, we found that 53 patients, or 50%, had an anaerobic threshold of less than 10.1 mils per kilogram per minute, and 16 patients had a VO2 peak of less than 12.3 mils per kilogram per minute. If we were to increase aerobic fitness even marginally through a prehabilitation program by 1 mil per kilogram per minute at both the anaerobic threshold and VO2 peak, this could have a large impact on this cohort. This would ultimately reclassify 14 patients, or 26%, and 6 patients, or 38%, from high risk to low risk respectively. Our data shows a large number of oral and/or maxillofacial cancer surgery patients who have CPET values associated with increased postoperative morbidity. Even small improvements in aerobic fitness through implementation of exercise prehabilitation has the potential to vastly reduce the number of patients who are deemed higher risk. Thus, future prehabilitation studies should assess the feasibility and the impact on outcomes in this cohort.